If you haven't heard about Anchor by Spotify, it's the easiest way to make a podcast with everything you need all in one place. Let me explain. Anchor has tools that allow you to record and edit your podcast right from your phone or computer. When hosting on Anchor, you can distribute your podcast on listening platforms like Spotify, Apple Podcasts, and more. It's everything you need to make a podcast in one place. And best of all, Anchor is totally free. Now download the Anchor app or go to anchor.fm to get started. Now you're tuned in to Uncomfortable In-House Conversations with HB, the podcast.
Hello, thank you for tuning in to Uncomfortable In-House Conversations with HB. Today I'm having over a special guest, nurse practitioner, Dr. Katina, and also author, speaker, and TV and radio health expert. How you doing today, Miss?
Hello. I am glad to be here. Thank you for having me here today. This is going to be a wonderful conversation. Men's health is important. I'm always talking about women's health, but men's health is foundational as well. And we need to talk about it, and men need to take control of their health. So thank you for having this conversation, because it is vital to all men.
I really appreciate you saying that. Like I said before, a lot of times when I was, coming into that, there's different topics and things that I want to, to express and go through. And this topic is kind of near and dear to me because a couple of years ago, I always tell everybody my mother passed away and my father is a widow. So a lot of things that she would keep up on, now it's, pretty much me. And as I'm noticing, he's not, up on a lot of things, and I went with him to a couple of his doctor's appointments, and it's things that I didn't know, trying to look forward and seeing that, that's going to be me in a couple of years. So it's things that I want to know. I want to ask questions, and because I know you for a long time, and also, went to high school together and everything, I feel comfortable, and you have a lot of knowledge of this. So as far as a black man, let's start with that. High blood pressure. Because it's a lot of things that we don't know. So maybe, give me a little brief, synopsis on that.
So it's more than just high blood pressure. On social media, I'm always talking about the importance of knowing your health status, okay? And that's for everyone. But knowing your health status is 3 things that is foundational to your health that you should know. And it's called the BCB: blood pressure, cholesterol, and blood sugar. Blood pressure, that is key to control. If your blood pressure is not stable, it can definitely cause a stroke, kidney disease. It can cause enlarged heart, congestive heart failure. So it's important to at least do like a blood pressure check, maybe one time a week. Okay. If you follow me on social media, I have Blood Pressure Tuesdays. And I encourage everyone to go to CVS, Walgreens, or some type of pharmacy and do a spot check of your blood pressure. I've had patients that, or not even my patients, but just fans on my social media that came and they say, you know what, just because you said go check my blood pressure was high and I had no idea. I had to go to the ER. They almost had a stroke. Their blood pressure was 200 over 100. It was really high. And as we may or may not know, high blood pressure, hypertension, uncontrolled is a silent killer. A lot of times you do not have any symptoms. You do not know when your blood pressure is high. The normal blood pressure should be 120 over 80. All right, that's the normal blood pressure. When you start to get in the 140s, I hope y'all writing this down now. It's important to write down these tips. If your blood pressure gets in the 140s over 90s and is continuously in that, then you definitely need to tell your healthcare provider, because again, you don't want things to get out of control. You want to take charge now of your health to prevent these health conditions. So blood pressure, cholesterol, remember we're on the big 3, BCB. Right. So that's the blood pressure, cholesterol. That's important. Now, when you have high cholesterol, when your cholesterol is not controlled, it will actually clog the arteries of your body, not just of your heart, but your penis as well. So if you have
so I'm glad you just said that. Now we getting into the good stuff, because that's what I was going to ask you about. But go ahead. That's problems right there.
So if that cholesterol, people forget that the plaque deposits on the arteries of not just the heart, but all throughout the body. So if the blood pressure is not stable, if the cholesterol is not low, that can affect sexual health as well. And then also your blood sugar, that's diabetes. If the blood sugar is high, that's going to cause diabetes. And certain diabetic medications can cause, interference of a lot of things for men, such as their energy level and things like that. So blood pressure, cholesterol, and blood sugar, you should know your numbers. If you don't know those numbers, next time you go, take charge. Get a copy of your blood results when you go to get your blood work. Say, I'll get a copy, so that when you go back 6 months later, that way you can compare your numbers each time you get your blood work done. So the big three, BCB. And when you get your blood work done, we'll talk about some important blood tests that needs to be done, especially when it comes to sexual health.
Right. Mm-hmm. So before we get into that, sugar. So as far as my sugar levels, because that's also high on the list, us as black men. Mm-hmm. What's the number that should be on that?
So the normal blood sugar should be 70 to 100. Okay? Blood sugar 70 to 100. If it raises on average if it goes greater than 100, usually between 100 and like 115, you will be considered as a pre-diabetic. But if it's any higher, like in the 130s, 140s, 200s, that is not good. If diabetes is not controlled, it can definitely cause kidney failure. It can cause blindness. It can also cause what we call peripheral neuropathy, which is numbness and tingling to your feet. You can't feel anything. So the blood sugar. And then we also go by a number called the hemoglobin A1C. Now, if you are a diabetic and you're listening to this podcast right now, you need to know the hemoglobin A1C. That's the blood test that tells us how your sugar is running over the past 3 months, okay? So the hemoglobin A1C, if it's 6.5 or higher, you are officially a diabetic. And this is a blood test, actually, that when you go for your health screenings, your healthcare provider is definitely going to check.
Okay. I'm kind of not big on medication. So as you see, I showed you my blood pressure, and it is. And to everybody to know, it is high. It is. I want to know, what can I do, or is there anything that I can do besides taking like medication to lower my blood pressure? Mm-hmm. Is there any kind of holistic, measures besides, exercise, anything of that, or kind of diet I use?
Well, there are several things that you can do to help, lower the blood pressure. But when it gets to a certain point, you gotta protect yourself. So if the blood pressure is, like I said, usually like in the 150s over 90s, or 160s over 90s or higher, you may need to protect yourself with some type of medicine.
Okay.
Then guess what? When you make the lifestyle changes, you can come off the medicine. Because what happens is, a lot of times you haven't made those changes, and if your blood pressure continues to get high, then you'll end up having a stroke while you don't want to get on medicine. Right. So some of the things that you can do to prevent from having a stroke, or if you notice that your blood pressure is trending up, then you definitely need to exercise is key. That is important.
Right.
Also, getting adequate sleep. You have to get at least 6 hours of sleep. That is important. Sleep is when our body rejuvenates. That's when it heals. That's when the immune system gets stronger. Sleep is important. So you want to get at least 6 hours of sleep. And so exercise, sleep, and of course it's the eating, all right?
Right.
Staying away from caffeine.
Okay, I don't drink. I'm not.
Caffeine.
I'm not a coffee drinker.
Those energy drinks also.
I don't drink those.
Okay,
either.
so no more Monsters, huh?
No, I don't.
All right, good. Because what those does is they actually constrict the vessels, and they make the blood pressure high. They make your heart rate elevate, thus elevating the blood pressure.
Yeah, I think a lot of my issue is I'm a cognac drinker.
I was gonna alcohol.
That's what it is.
Alcohol it brings it up because what happens is alcohol has so much sugar in it. So and alcohol will actually increase the weight. So the more alcohol you drink, sugar turns into fat. You gain the weight, and guess what happens to the blood pressure? It increases.
It does.
So that's the ultimate, staying away from alcohol, drinking your water, adequate water, and also, staying away from salty foods. It's the foods we eat.
Okay, that too.
Yes.
I'm not big on salty foods either. It's for me. I just think it's between stress and the alcohol intake. I like cognac. I can't lie. That's my drink, and I gotta calm down.
And then it can be family history as well. So sometimes
my
because
parents have blood. My father has high blood pressure.
Because I have vegans, people who only like alkaline vegans as patients. They only eat seeds, Yeah, they're vegan. They're true vegans. Okay. And they're pretty much just eating plants,
I'm not judging the vegans. It's just different. That's all.
But they also have high cholesterol. They also sometimes have high blood pressure. Sometimes it's in the DNA. It's genetic. So these are some factors that we can't control.
Right.
But when we know we have this in our family, we can do things such as the things I just mentioned, diet changes, staying away from the fried foods, eating your lean meats, your vegetables, your fruits, your healthy fruits, and getting your adequate sleep, staying less stressed, having me time. That's important. Relaxing.
I'm learning to do that.
Delegate some things.
Right.
I know as a man, you all are responsible for a lot of different things.
Right,
you have to multitask. So it's important to actually have some time out for yourself as well. But we have to, the alcohol is the big culprit, especially in the African American community, that really elevates the blood pressure. So a lot of times I've seen where patients, they would come into the office, black men, I have to put them on blood pressure medicine, but guess what? They make a pact to themselves that, I want to make a lifestyle change. I want to get off this medicine.
Okay, so let me ask a question. Listen, I know it ain't no dumb question, but I preface my statement by saying this. It might be a stupid question. My issue is, I've heard before, you're taking these blood pressure medicines, I don't want nothing to constrict my meat. And you know what I'm saying? Y'all know what I'm talking about. I don't want nothing to mess that up. I'm an older man, and we still have egos, and I'm quick, I'm fast. I can't do the things I used to do. You know what I mean? So is that true, or?
Well, just so you know, there are many medicines out there that does not affect the libido and does not affect the erectile function of the penis. So there are certain medications that do, though, like beta blockers, such as metoprolol or anything in that category. But there are a lot of medicines that does not cause. I don't want to be on Niagara. You know how the old folks say, the old folks, you go give me that Niagara pill. But that is a myth that all blood pressure medicines causes erectile dysfunction, because it does not. I have plenty of men, because the real issue will be, if you don't take anything.
That thing gonna be limp, dog.
Oh, Lord, geez.
It ain't gonna work.
You're right, the blood flow. There's not gonna be adequate
like, what happened to that dude I heard of? I don't know. Hey, but seriously though, like with that, and I appreciate that. Want to kind of segue into the thing that you were saying that a lot of us don't like to talk about. Those blood tests. As far as men health, heterosexual males and homosexual males. As we know in our community, HIV is still on the rise, and not only just that, other communicable diseases. So what do you say about that?
So yes, you definitely want to get your blood test done. If you do have multiple partners, then it's important to get checked more often. So like every three months or every 6 months, you get your STD checked. But besides the STDs, there are many different blood tests that you should get as well, such as like your blood count to make sure you're not anemic.
Okay.
Your prostate level to check for prostate cancer. So a lot of men are afraid to go to the doctor's office because they think that they're going to have to get
fingers in my booty.
But a lot of the providers don't do that anymore. We actually do a blood test called a PSA, which is a prostate serum antigen, and that's through the blood. Now, if that comes back elevated, then I got to send you to the.
She got to use that big finger, dog.
Then I'll send you to the urologist, and he'll do it. Okay. So then they'll do it definitely. But you want to check. That's going to check you for prostate cancer. So that's some of the blood tests: blood count, prostate cancer. Also, very important for men's health, the testosterone levels.
Okay, I was about to say that
too. If you're having low energy, if you're feeling tired, depressed, even mood changes, you're very depressed. You just don't feel yourself. You don't have that motivation anymore. Then the testosterone levels could be low.
Okay.
Even if you're having premature ejaculation, like if you're coming really early, as soon as you enter inside of the vagina or the anus, or if you're premature ejaculation, or sometimes you're having delayed ejaculation where you can't come at all. Sometimes it can be the testosterone levels as well.
Okay.
So, and as far as, getting erected, some people can't get erected. It can be because you have, they call it hypogonadism, which is basically a low testosterone disorder. So when you're feeling this way, fellas, there could be a reason. You go in, get your blood test. Also, the thyroid test is something. The thyroid is what regulates our metabolism. Men and women. So it doesn't just pertain to women. Men have to get their thyroid checked as well. So your thyroid, your blood count, your prostate test, your blood sugar, your cholesterol, your liver enzymes, your kidney functions, and your testosterone levels. All of those are key. And then, of course, your STD testing, and not just HIV. You got your syphilis. You got your herpes.
Man, that syphilis still out in these streets.
You got the hepatitis C.
Syphilis still out in these streets.
It's actually a rise in syphilis.
Jeez.
Syphilis, it's actually a rise. It's at one point we saw it. It's going down now, but at one point we saw it elevating. Yeah.
Oh man, that's wow.
Yeah. So don't just get your HIV test. Make sure you get the syphilis test, the hepatitis C test, your herpes test. And then, of course, your gonorrhea, chlamydia, and trichomonas, too. A lot of people don't get...
What the hell is trichomonas? Trigger what? What's that?
Yeah, trichomonas is an STD, and it's a parasite, actually.
Oh, wow.
It's very silent. A lot of... we detect it a lot of times in women when we do their pap smears.
Okay, gotcha.
In men, it's really asymptomatic, meaning you don't have any symptoms.
Okay.
But
you're still walking around with that thing, dog.
Yeah.
So you got to get the thing straight. Yeah.
You got to get it checked. And a lot of STDs don't have symptoms. So just because you feel fine, just because you have no symptoms, you still need to get checked. Still need to get checked. Get the blood work done. Go for your yearly physicals. Check your blood pressure.
So how often should I know I don't have to do everything all at once, but to constantly check on myself, how often should I do? 6 months, a year?
So you do want to make sure you go in at least yearly. Now, if you do have a condition such as like high blood pressure, diabetes, high cholesterol, then most likely your provider will tell you to come in every 6 months, because we have to keep on track of your numbers. We have to see if they're improving or getting worse, see if we have to adjust anything in your diet or your medications. So definitely every year or every 6 months, and then sometimes every 3 months.
Wow. Okay, that's good stuff.
And so those are some blood tests we definitely need to get done. But you also have your health screenings that you need to get done as far as your eye exam. Okay. That should be once a year.
That's something because I'm now starting to have issues with that, and I'm like,
yeah,
you know, I thought it was beer goggles. Like that girl, that ass look. You see, no, that's my eye. No, I'm just playing, but yeah, I definitely need to get working on that.
So your eye exam, your dental exam, that's important.
Oh, I just got my wisdom teeth out, and I gotta go.
It's important to get it clean, okay? Because a lot of you guys just brush your teeth, but the gum health is important.
I didn't realize that. My dentist explained that to me as far as my heart.
Yeah,
and you know, and he says that
bacteria from the mouth
and goes down to your heart, and people have a lot of issues where they don't get, you know, when they don't get their grills straightened out.
Yeah, and then also you can transmit a lot of bacteria and yeast to your partner. So if you got yeast on your tongue and you having oral sex, and you're wondering why your partner is having frequent yeast infections or frequent bacteria.
So it ain't her, dog. It ain't her. It's your nasty ass.
It could be, you know, something yeast in the buildup and bacteria buildup in the mouth as well. Yeah. So get your eye exam, dental exam, get your colonoscopy if you're 45 and older. You go get your colonoscopy. That checks for colon cancer. Yeah. Colon cancer is very prevalent in the African American community.
Very
Forgot his name, but the Black Panther, he died
he did.
Early from colon cancer.
And it just take, you know, just for them just to look into it.
Yeah, and a lot of times when you start having symptoms like blood in the stool and abdominal pain, it's too late. So preventative care is key. Early detection is important. Don't wait till you're having problems, man. Don't wait on your girlfriends or your partners to make your appointments. You need to take charge of your health. After you listen to this podcast, say, you know what? I'm going to make a change.
Because she got me scared right now. I'm telling you. And I'm telling y'all, player, you better do it. Because all it takes is when your girl go talk about, baby, we're going to go get some insurance on each other. You know they live longer than us, y'all. So you need to go ahead and handle that. You know what I'm saying? As soon as she want to go get that insurance and talk about 150, 250, she already sees something. So we got to go get that check, man. I really appreciate that. One more thing, you know, before we, you know, slide over to the live, something that you mentioned that I think is very, very important is men's mental health, especially in the day and time that we live in. Us as black men, it is very, very, even for me, had to realize, you know, through trauma experiences, you know, I always say 2018 was very hard for me. And dealing with my mother's death, going through a divorce, just you know, dealing with my father, you know, being a widower, trying to help him. It was just a lot. And, you know, I tell a lot of times us as black men, we don't really get grace. And we don't understand that breaks you down mentally. And we're so used to just not complaining and just be like, okay, I got to be a man. And this is what it's supposed to. So what are some things that we can do to realize, you know, some things that we're having some issues, you know, emotionally and mentally?
So if you feel like, you know, you're feeling low energy, when you feel like you're down, when you're feeling like you don't want to be bothered, when you're short-tempered, when you're angry all the time, when you are sad or even crying, those are some symptoms that something's going on mentally. You may have some anxiety. A lot of times men, when they present with anxiety, when they're angry, they're restless, they can't sit down, they can't relax, they can't watch TV, they always worrying, they always doing something instead of relaxing. That's anxiety. And then, you know, depression on the other side, you have loss of interest. You don't have the interest in the things that you used to, you know, want to do or you enjoy doing. You have difficulty sleeping, or you're oversleeping, or you are overeating, or not eating. So these are all some signs and symptoms of depression and anxiety. And these take a toll not only mentally, but they can affect you physically as well. I have several guys that come into the office and, you know, they have low libido. They have no interest in sex because they're mentally not healthy. They're not mentally stable. So if you notice these signs about yourself, don't be afraid. Talk to your healthcare provider and then see a therapist. A therapist will really, really help you. If it gets to the point, the therapist will evaluate you. And then if they feel that you need, medications, then they'll go that route. But a lot of times therapy is the key. Having the ability to actually talk to someone and just, they'll give you some strategies on how to deal with certain life stressors, how to deal with obstacles, how to deal with just the things that you're going through in life. So therapy actually helps. It's actually a good thing. So recognizing those signs and symptoms, not ignoring the signs and symptoms, and getting help is key, Black men or men in general.
Men in general, that's exactly what we need to do, because I'm glad that you came on here, man. It's really needed between us, us men, and just me myself. Is things that I wanted to know, I needed to know, and sometimes I am very stubborn. Everything with us is masculinity, and we don't want to look soft, and we don't want to. And we're killing ourselves, because we don't want to ask no questions, or we don't want to do this, and we don't want to do that. And a lot of things that can be preventive. And, I know it's a thing going around now when we say generational curses. And I want to put that out there to us as men, for us to take accountability of our health. Not just sit there and don't say anything and try to be a man about it, because being a man is being there for your family. And that's something that we need to do. And I feel that, by doing this, hopefully it reaches somebody, and just like it reached me. And, also I'm going to take this to my dad and let him hear this, because fighting with him, and at the same time I'm not trying to reinvent the wheel, because I'm looking at him and I'm like, homeboy, that can be you. So
and you want to break the cycle. And most of my because I have patients that are in their late 50s and 60s. They don't drink alcohol, they eat healthy, they exercise, they get adequate sleep. They're going strong. They're going strong in the bedroom, sexual health. They're going strong in mental health and physical as well. So, stop putting all those bad toxins in the body all the time. Of course, occasional alcohol is fine, everything in moderation, but you guys know when you go overboard. Not only does the alcohol affect you weight-wise, but, just artery-wise and sexual-wise and mental-wise as well. So just use this opportunity to, like I say, if you don't make any changes, this is the time now to say, you know what, I do want to change. I want to start by going and getting my physical done and my blood work, and then going from there. Because guess what? If you never go to the doctor's office, and you finally decide to go when you're in your 50s, then you got to get on blood pressure medicine, high cholesterol, diabetes, all because you never went before when you were younger. But if you go early, you catch things early on, and because preventative care and early detection is key, that's vital. And if you don't want to be on medicine, start now with making those changes.
Listen, that's very much true, because if you don't, you're going to be one of them people that's looking at your grandparents' house, and they have all these medications, and you just looking at it, you picking them up. Because I looked at my dad's cabinet one day, and I was like, do you really need all of this? But he did, because he's not consistent, especially with his blood pressure. So he'll take it, and as soon as he think he feel better, he's off it. But like you said, he's not making any necessary changes. And I also too, I think a lot of the lifestyle and things that's going on around with him, also with stress, also causes that. But again, just to recap, I just want you to say those three things that you said.
Yeah, the big three: BCB, blood pressure, cholesterol, and blood sugar. Those are foundation. So you need to know those numbers, know your health status.
Okay, so, and again, I appreciate Dr. Kennedy coming and talking with us and talking with me. And then hopefully, later on, I'll hopefully be able to have a conversation, about, maybe women's health, and just also couples, things that couples need to do together to, again, dream work make the team work.
You got it. And for those who want to follow me on social media, you can follow me on IG at Dr. Katina _DRK. And if you need counseling, I'm a dual certified family and mental health nurse practitioner. So I do therapy as well for couples. I do therapy for sexual health if you're dealing with sexual decline in your health in your relationship. And then I love my teens, so I work a lot with my adolescents. So if you have a teenager that needs some help, he or she can see me as well. And then of course your primary care, gynecology, and your men's health. So you can go to my website, drkatinahealthandwellness.com. You can just Google Dr. Katina and I'll come up and you'll see my website. So, but if you're not in Florida or the South Florida area, make sure you find a good provider, someone you trust, someone you can talk to and connect with, and you're not afraid to ask questions. Because a lot of people come to me, they're like, because they relate with me, they're not afraid to ask me questions, talk to me. So you want to find somebody like that.
Well, good, and we definitely will. She's a one-shop stop. she does everything. So again, I appreciate you for coming in, and we're gonna go over here to online, with the Q&A questions. All right. Hey, again, I want to end this on a note. I want to thank Miss Katina Kennedy for coming on and giving me your expertise. I really appreciate it, and I hope my audience appreciate it too. With that being said, I'm going to go ahead and close it out with you guys tonight with one of my special HB-isms. And this one here is, there are no secrets to success. It is the result of preparation, hard work, and learning from failure. Thank you and have a good night.